What are steroids? Steroids are a special type of chemicals that are called hormones. Our body makes many kinds of hormones, and each hormone has its own effect that is different than the others. Also, there is more than one type of steroid hormones. Glucocorticosteroids and sex hormones are both steroids, but they are different from each other. In this video, we will talk about the glucocorticosteroids hormones, and we will refer to them simply as steroids. What illnesses are treated with steroids? Doctors prescribe steroids for a lot of illnesses, including rheumatologic diseases like rheumatoid arthritis, systemic lupus erythematosus, gout, and others. These illnesses cause pain and swelling in the joints and other body parts because of inflammation. Steroids are used in these illnesses because they help reduce the inflammation, and this will help reduce the symptoms. How are steroids given? Steroids can be used in many forms. Prednisone is the most common type, and it is a pill that is taken once or twice a day. Medrol and dexamethasone are other steroids that can be taken as pills. Also, steroids come in an injection form that can be given in the muscle or in the vein. In cases where there is one or two joints that have arthritis, the doctor can inject the joint itself with steroids. What are the side effects of steroids? Steroids can cause many side effects. As with other drugs, it is always important to follow the doctor's instructions while using steroids. Some of the side effects can happen within hours to days after starting therapy, like difficulty sleeping, feeling anxious, high blood pressure and blood glucose, and swelling in the legs. After a month of therapy, other side effects can happen, like infection, decreased bone strength, easy bruising due to thinning of the skin, hair growth on undesired places, weight gain, and eye problems like cataract. Who can't take steroids? Persons with diabetes mellitus, heart failure, lowered immunity, or stomach ulcer are more likely to have bad side effects from steroids. They can still take steroids, but the dose and length of use might need to be reduced based on their needs, and the doctor should explain this to each patient so they know what they have to look for while on steroids therapy. Can steroids be taken for a long time? Because they can cause bad side effects, the lowest dose of steroids should be used for the shortest amount of time. Still, some people will need to use them for months or even years to help with their illness. Also, you need to remember that if steroids are taken for longer than 1 month, it is important you do not stop them without talking with your doctor. Unless done in the right way, stopping steroids can cause a life-endangering illness. The same is true if steroids are missed for a day or more because of throwing up or other reasons. If that happens, you must call your nurse or doctor right away or go to the emergency room to get the appropriate help.